We're going to be talking about refugees, and we just wanted to give some context to the numbers. So, the U.S. and refugees. First slide coming up here. Where do refugees come from? Well, in the year 2016, the U.S. is set to admit some 85,000 refugees. The bulk of them, 34,000, will be coming from the Near East and Southeast Asia. At least 10,000 of these will be coming from Syria. Oddly enough, before the crisis in Syria, the U.S. actually admitted more Syrians into the country than they will during this time of conflict there. If you look down the line, 25,000 folks are set to come from Africa, 13,000 from East Asia, and Europe and Latin America round out the next two most populous countries sending folks here. So looking at the Obama administration, they plan to raise the number of refugees admitted in 2016 from 85,000 to 100,000 folks. And the U.S. to date has taken in some 3 million refugees since 1975. Going forward just a little, I'm going to show you where refugees go. Now, the 4 states that receive the highest number of refugees are California, Texas, Florida, and New York, which coincidentally happen to be the largest 4 most populous states in the United States. And right here in the New York context, 514 refugee children have been settled in New York City. That's a doubling of the number from the previous year that this was reported in 2014. So that's a little look at refugees by the number as they stand in the U.S. and in New York. Now let's get into the A block.
On April 21st, next Thursday, SUNY Downstate School of Public Health is hosting a conference called Global Refugee Crisis Equals Public Health Crisis. The woman organizing the conference is here to explain that title to us, but she's also going to talk about how it affects us here in New York City. We want to welcome back to BK Live our old friend, Dr. Monica Sweeney, who is, okay, I'm going to take a breath here. Vice Dean for Global Engagement and Chair of the Department of Health Policy and Management at SUNY Downstate Medical Center's School of Public Health.
Thank you.
Did I get that right?
Yes, thank you.
Thank you for joining us again, Dr. Sweeney. So tell us, for those of us who don't know from the beginning, what is the difference between a refugee and any other kind of legal immigrant that comes into the country?
Refugees come because it's forced migration is another way of remembering the difference. Mm-hmm. Forced migration is when they come because of war. Syria is the perfect example, mm-hmm. although there are many others in the world. There is sexual orientation. There is religious persecution. There's being part of the wrong political party. So if you think of it as forced migration, people are pushed out of their homes or they run for safety to someplace else. That's the difference. Okay. Immigrants in general come for a variety of reasons. For example, I know a family where it started with one person and now there are about 15 of them here. Mm-hmm. So they came because their elder was here who'd done well. They're from an economically deprived Caribbean island nation, so they end up here. And so there are many reasons why people become legal immigrants, and but it's very different from being forced to flee your home.
So, Dr. Sweeney, we just spoke about the fact that Syria, we're seeing fewer people who are coming from Syria than before the time of conflict, and you made the distinction between immigrants and people who are refugees. I wondered if they have different health concerns or even health outcomes that we expect if someone is coming here of their own volition, saying, I want to make a better life, versus I'm fleeing a war-torn country or some conflict.
Absolutely, because when you're fleeing a war-torn country, mm-hmm. or any of those other reasons we talked about, you have the stress of trying mm-hmm. to get to where you're going. Just this morning in the news, as if it was done for our talk, they talk about the people that were trying to get into Macedonia from Greece, and how the children even got rubber bullets to the head, and there were over 300 people injured when they tried to break down the fence to get from Greece because there was no hope. So yes, people who decide to come here, they come hopeful, they're afraid, but they're excited because they're going to start a new life. Right. In many refugee camps, the average length of stay is 12 years, and there's some that have been going on for generations, like in Palestine.
Right.
So mental health issues are major when people have fled what the forced migration calls on. On the other hand, immigrants who come here of their own volition have better health outcomes in many instances than natives.
Wow.
For the first generation. For the first generation.
Like mine.
Okay.
But after that, they lose that advantage. They have more family support. They bring their eating habits, you know, the Greek diet or the Japanese diet from wherever they're coming. They're healthier than we are. But then after being here, they lose it.
Then we just become like everybody else.
There you go. That's unfortunate.
But there also has to be the trauma of what they've experienced in the country as well, right? So it's not just the stress of getting where you're going and how that's going to turn out, but also everything that you just came from and are fleeing from or being pushed out of, which has to feel, I can only imagine, absolutely terrible to feel like you can't stay in your home.
Well, you not only can't stay, but the chances of you getting back to anything that you've built your life that's recognizable is just not there. And to think that you've built a career and you have your social set and you have everything, and then you're forced out, and then many times families split up because they think this one has a better chance of getting there, and then you'll send for me. It is nothing short of a nightmare. And when you get to the refugee camps, they are awful, really horrible, from the size of the housing that you have to live in, 3 to 5 people to a room. You know how we want to go out and get a cup of coffee, or we want to go buy a card to send to a friend, or we want to go to church or synagogue or whatever we go to, and you just go to where you're used to going? There's none of that. And so mental problems, depression and anxiety and then post-traumatic stress disorder, of course, the longer you undergo this ordeal is real.
So Dr. Sweeney, how do these patients in the Brooklyn context present? Because we know in some instances, like in schools, they don't really track how young migrant children do. They sort of get soaked into the general population. But is there a different track that folks can get on for medical or health screenings?
There are special places in New York, including here, especially for people of torture who've been through torture, because that's also forced migration often. There are special clinics. New York State just sent out guidelines for how to deal with people who have come through some of these ordeals. And so all of the things that we've just mentioned, but in addition to the mental health problems, many people undergo physical problems, diarrheas because they have unclean water sources, skin problems, mold in the damp places they live in. So you have to be cognizant. And of course, it depends a lot on where you're coming from, which diseases you have. If you're coming from, say, Greece, you're not likely to have malaria. But if you're coming from Africa, many places you have malaria. So the people who come have the spectrum of diseases that you can imagine. And the worst part is that they've been neglected for many years, so that they're all often very, very advanced in whatever it is that they have.
Gotcha.
Dr. Sweeney, why have we received so few refugees here in New York? I mean, we saw that we're one of the biggest states who usually receives refugees. What's going on here now?
We still take a lot of refugees in New York, but they're not in New York City.
Gotcha.
Okay.
New York State is one of the top 4 states, but they're not in New York City. Because, you know, there are refugees in New York City. As a matter of fact, one of the people coming on the show, not the show, one of the people coming to my conference at the School of Public Health at Downstate is an organization in the community that resettles refugees. They're not as many, but they have as many issues and sometimes additional ones because it's New York City. So yes, we have them, and there are organizations in the community that help them get established. What we don't talk a lot about are the refugee children, the unaccompanied refugee children, who are also called unaccompanied alien children. And there are quite a few of those. In the last year for which we have data, there were over 500 in Brooklyn,
Brooklyn.
900, over 900 in Queens, which is most.
The most.
But they have a better, easier time of it.
Yeah.
Our humane side definitely comes out with children, and the average length of stay is 35 days in the shelters that they live in.
So speaking of that humane side, we saw Canada's Prime Minister shaking hands, bringing teddy bears and greeting refugee families as they came through, and their health system maybe absorbed them better. The last time you were here, we talked about Obamacare and the fight for that. So how are we paying and really absorbing people into a system that a lot of people feel is overstressed already?
Well, that's one of the reasons we're having the conference, because we want everyone to know that each of us has a role in being welcoming. Because many times refugees go to countries that mean to do well, but the longer they stay, the thinner the welcome becomes. And one of the things that happens in the United States, it seems to me, is that we don't have that problem. In spite of what some people are saying about closing our borders and building walls and not letting in people of certain religions, we don't go there. What we want to do at the conference at Downstate is to show that all of us needs to get involved and have a role, so that maybe when we know that there's a school that's absorbing these children, we could go with the welcome package.
Gotcha.
However, having said that, we could give them to the school to give to them, but they would never let us know who they are.
Yeah.
To protect the children, they don't let people know who they are. And that's a way of integrating them so that they don't get bullied or harassed or embarrassed or all the things that kids go through.
Wow. Dr. Sweeney, what else can we expect at the conference?
You can expect to hear one of the leading experts on refugee situations. You can expect to hear from a refugee who's resettled here in New York, and from the woman who runs, who's part of an agency that resettles them. And we are going to give out packages for people who are there so that you'll know how you can be engaged in helping the people who need it.
Phenomenal. Speaking of engagement, get yourselves engaged this Thursday, next Thursday.
Next Thursday, the
April
21st.
at 5 o'clock at the Alumni Auditorium at SUNY Downstate. You'll get to sit in with our friend Dr. Sweeney.
And stay for some nice refreshments afterwards.
And there's refreshments. As if you needed any other incentive. Thank you so much for being here,
Thank
Dr.
you. It's always a
Sweeney.
pleasure
Love it
to
when
see you,
stop
Brian.
by.
It's a pleasure to see you.
Pleasure to meet you.